Hi, my name is Savanna. I am one of the dental hygienists here at Summit Dental Care. Today I'm going to talk to you about proper brushing and flossing techniques. The reason why it's super important to have proper home care is because it reduces your risk of cavities and reduces your risk of periodontal diseases. Our main goal when brushing and flossing at home is to reduce that bacteria that causes plaque and tartar buildup inside of our mouth. Believe it or not, there is right and wrong ways to brush and floss, so I wanted to show that to you today. Extremely important with any home care routine, you want to make sure that you're brushing for 2 minutes, morning and night, and flossing at least once daily. Many people use a manual toothbrush when they're brushing at home, and so the best way to do that is you don't want to take the toothbrush and point it directly at the tooth, and you also don't want to have it directly pointing at the tissues. You want to have it kind of halfway in between at a 45-degree angle, and you want to do small little circular movements. What that does is it helps to make sure that you're not getting any buildup along the tissues and that you're thoroughly debriding all of that buildup. Although every mouth is different, the majority of people would also benefit from using an electric toothbrush over a manual toothbrush. The benefits of the electric toothbrushes is that it can reduce plaque up to 7 times more effectively than a manual toothbrush. And although it's similar in how to use them, there is a little bit of a difference. Because there is some vibration going on, what you want to do is kind of let the toothbrush do the work for you. So instead of doing lots of little movements here, just like with the manual toothbrush, you want to place it at about a 45-degree angle down to that tooth, but you want to just kind of let it do the work for you and just glide it along those tissues there. Flossing is an extremely important part of your oral hygiene at home because it helps to reduce the risk of cavities in between the teeth where those teeth are touching. Our toothbrush bristles are too big to reach in between in that contact, and so that's where flossing comes in. What you want to do is when you get the floss in between your teeth, many people kind of just pop it down and pop it right back up, which is great because you're getting in between those teeth. But what you want to do to take it a step further is to just get that floss down, and you want to make a C with that floss until it goes fully underneath those tissues. What that is going to do is that's going to help to reduce the risk of periodontal disease because it's going to be cleaning out that plaque and bacteria from underneath your gums. Another extremely helpful tool that we tend to recommend here at Summit Dental Care is a water pick. Water picks are awesome for cleaning around implants and underneath bridges. It also helps to keep braces really nice and clean. These water picks are awesome in reducing risk of cavities, periodontal disease, and inflammation of the tissues, which is gingivitis. When using these water picks, you always want to start on the lowest setting and work your way up higher. With this, again, it's all about the 45-degree angle. You don't want it pointing directly down at the tissues or directly at the tooth. You want it kind of 45-degree angle, and you want to kind of scallop along the tissues and then point in between the teeth, and then down and in between the teeth. And you just kind of follow that. With that, you do want to make sure that you're reaching on both the front and back sides of your teeth to make sure that you're effectively cleaning off all that bacteria. Depending on the patient, we do sometimes recommend adding in a little bit of non-alcohol Listerine into your water pick. Reason being is because it can dilute down some of that bacteria and do a little bit more of a thorough job as you're deriding that bacteria out of the tissues. Usually we recommend just taking a little bit of room temperature tap water and filling it up. And you want to go make sure that you do it long enough that you're getting every surface of every tooth. So sometimes that does mean that you have to refill the water pick before finishing. If you have any questions or would like a demonstration inside of your mouth for how to properly brush or floss or use any of the tools that I talked about today, call into Summit Dental Care and we'd love to help you.